at Ride Health, we provide a comprehensive transportation solution that allows different organizations such as health systems, health plans, life science organizations, community health organizations, local and state government to be able to utilize us to be able to request rides for their patients, for their participants, for their members, for their clients, to help them get to and from whatever healthcare needs they may have. This can be from a simple appointment to, food security, to access to mental health needs, to access to disability services. And the way we're able to do this is kind of these four pillars: request, match, ride, and analyze. So it's pretty simple. You would be able to log into our web-based platform. From there, you're able to request a ride. We take in basic demographic information, and using that demographic information, we then use that to match it with the correct provider. So the way that works, we actually contract with providers on a national scale. So we're contracted with providers such as Uber and Lyft and large taxi cab aggregates, in addition to providing higher service levels such as door-to-door, door-through-door, wheelchair accessible, stretcher vans, and ALS, BLS ambulances. So with whatever that patient's needs are, we're going to utilize it. If it's an on-demand ride, as in it's immediate, or if it's a round-trip ride that's been scheduled, or maybe it's a patient, who's behavioral health or oncology and they have recurring requests. All of those can be input, and then using that data, we're then matching it to the correct provider so that they have those rides ready for them when they need it. Once our ride starts, we then have a ride success team that then proactively monitors each of these rides. So we integrate into our technologically providers, and then from there we have a integration to our support platform that allows us to get a lot of context into what's happening with each of these rides. And then that support platform is then monitoring for a number of instances that can lead to ride failures or ride difficulties. So as these occur, our team can proactively intervene to help resolve them, to ensure that the patient gets to where they need. Our goal is to always ensure a great patient experience, ensuring they're getting to where they need to, because the goal is to help improve health equity across all populations or across all socioeconomic classes, to help break this curve of health and achieving that healthy outcomes that you would want. And then once the ride is complete, we do provide analytics for organizations, from out-of-the-box analytics to specific KPIs, looking at something like no-show reduction, or even giving you guys population health ideas of what are these pockets that patients are actually coming from, what are the subsets of rides they use. So in a way, when you look at transportation, we're part of SDOH. So that's social determinants of health. One of the main things there is going to be access to care. And when you start studying access to care and the limitations that patients face, one of the biggest barriers is transportation. And this allows, access to care in a multitude of ways. And we're working on, trying to help alleviate that through all these verticals to ensure that patients, members, just humans in general, can get to what they need and access what they need to be able to sustain a healthy life. So that's kind of a quick overview of Ride Health. I'll actually stop sharing my screen. So it kind of builds that more intimate setting again. Would love to see if you guys have any questions. If not, then we'd just love to have a couple questions for you all to learn more about, Alaska as a whole and kind of what you guys see when it comes to these areas.
So can I ask a question, Jacqueline?
Yes, of course.
So how does it work? I understand that we would call to get the ride, but how does the system get set up? For example, if we have 60 providers across Alaska, if a provider in Anchorage had somebody living in a supported living environment that needed a ride, how would they access the platform?
Yeah, that's a great question. So understanding a little bit of Alaska's geography and how transportation is done, it's more challenging than I would say some of the other states that we work in.
I'll bet.
But across the board, so a coordinator at a health system, or we'll just go to the hospital. A coordinator at a health system can access and schedule that ride for a patient. and the patient will receive messaging and their preferred communication, if it's text messages, if it's phone calls, if it's calling in, to get ride notifications. And there's actually an option where if an organization would like, they can enable a patient portal where a patient can log in and schedule their own rides, or only have view only access where they can just see all that ride information in addition to receiving those messages to ensure that they know this ride's happening. They can cancel the ride if allowed. They can modify the ride. So the goal is to reduce the coordination burden where a hospital is scheduling the ride, and then from there, ride health and the patient owns the rest of the experience.
So then the hospital hosts the website. So then does it work for a doctor's appointment that isn't at the hospital?
Yes. So the way that would work is, let's say we're working with University of Alaska, and in that system, we can on the back end break that to multiple teams, if it's hospitals, if it's studies, and then kind of build customizations there. And then when we work with you guys can give us a list of users that we will add to the platform that will receive credentialing. So then those users would be able to log in and schedule rides on behalf of these patients.
So do you have a relationship with UAA or the hospitals in Alaska, or you're hoping to come in?
We do not. That's kind of why Jacqueline and I decided to keep this more of an open forum. So to be honest, I don't want to sound ignorant, but I just don't know enough about Alaska. So just helping to learn more, knowing some of the challenges I've heard when it comes to transporting patients. I know a lot of times things involve, helicopter transport or plane transport. So just learning more from you all and sharing what we do to learn from each other and see what opportunities exist. But I know Jake has had his hand raised for a while, so well, happy to help answer your question.
I appreciate that. I'm patient, but I appreciate you calling on me. So I have a couple of questions. The first one, and I think this is a really fantastic platform. I think it was a presentation here on HealthTie in the last year or so where they mentioned that one of the biggest issues with discharge compliance was transportation, especially for people on the lower end of that socioeconomic spectrum. Is there an ability for a provider to basically make sure that before somebody leaves the ER that they have a ride back? Is that something that, especially, if somebody's an indigent member of the community who may not, once they're out the door, they're gone forever. But if you have the ability to set them up with that ride and have it paid for, you might get them come back. Is that an option that you provide? That's my first question.
Yeah, that's an option. So our platform is really flexible. You can do that, discharge ride if they just need to get out of the hospital. But if you're trying to plan that return ride, you guys can schedule in advance. And maybe it's a patient who needs multiple rides because it's a more serious condition. You guys can have that recurring request so that all those rides are scheduled on behalf of that patient as well. So that even though once they've left, they're aware and will constantly reminded that they do have these upcoming appointments coming for them.
Cool. And then part B is, logistically, so you're basically a scheduling or logistics platform, right? You don't actually have cars. I think in Alaska and probably a lot of places, the hospital systems have shuttle vans. Certain doctors' offices have shuttles. So you would more be a tool to coordinate those existing services, or do you actually come in and be the Uber of of medical transport?
Yeah, that's a great question. So we currently don't own vehicles. It's something in the next year we're looking to deploy in certain areas where the market is valuable enough for us to have our own subset of drivers and vans, just because of maybe rural areas or just the population base. But outside of that, just contract with all your local providers for the needs you guys have. And one thing that we'd be able to do across this next 6-month period is, if a hospital system or if a clinic has a subset of vans, help them use our plan, like you mentioned, logistically, to use a central platform for transportation to even schedule those vans and those rides within this platform.
And do you also then provide a way for those existing transportation platforms to bill or to otherwise document that transportation in a way that is friendly to payers?
So payers becomes a little tricky, to be fully transparent, because The way the market currently works across the United States is if you're looking at Medicaid rides, most states are contracted with a specific transportation broker. So if a patient is using their Medicaid benefit for transportation, they have to go through that broker. And then a lot of health plans, when we're looking at Medicare as well, they've contracted with their own provider. So there's not specifically a code where, you guys utilize Ride Health, you bill them for that code and they'll reimburse it. But what we've seen is with a lot of organizations, if Medicaid or Medicare is giving them dollars specifically to manage for transportation, then they can utilize those dollars to pay for Ride Health. But if it's something you're sending for reimbursement, that process is something we're working on achieving across a lot of states, but it's a little further out.
Thank you very much.
Excellent questions. I want to open it up. Is there anybody? I have somebody I want to call on if nobody steps forward, but are there any other questions?
Yeah, I have a question. Sorry, I don't know, my Zoom is freezing here, so sorry if it's a little shaky. So how are you, I'm not from Alaska, but how are you competing, or are you competing with Lyft for healthcare and Uber for healthcare? And where do you see yourself in the market?
Yeah, that's a fantastic question. So a simple way to start that is we're actually partners with both Uber Health and Lyft Concierge. So they're both part of our network as is. And what separates us and what we've actually seen across the board is them sending business to us is we're a comprehensive transportation solution. So we're not only doing those ambulatory rides that Uber Health or Lyft Concierge can do. We can then source those wheelchair accessible vehicles. We can source those higher service levels. In addition to that, as we all know, when it comes to Uber and Lyft, they have limitations to their network of how strong it is in each region. So what our network team then can do is, go source those local providers to fill gaps in rural areas or areas where these particular companies do not provide service. And then additionally, with our ride success team, that also separates us from them is where we're providing, almost per ride, both algorithmically and human intervention to ensure they're successful at all service levels, not just ambulatory. Even if you're getting a wheelchair accessible vehicle, you're still getting the same service as a front end experience and on the back end as well.
What do customers think?
That's a great question. It just makes me laugh because I always feel like I answer this question and everyone thinks I'm lying because I say all our customers are happy. But to dive in a little deeper into that, so across the board, we have I would say two main pockets of customers prior to joining Ride Health. There's the pocket that have had experience with transportation to some extent, if it's taxi cab vouchers, if it's using Uber or Lyft, and then there's the group that they've never used transportation before. We see the largest impact when we see someone who's used a different service initially and then transfer to Ride Health, where they truly can see the benefits of our ride success team, the higher service levels, how our network truly does build rural networks and these more difficult networks that their previous providers couldn't ask. In addition to, I know I'm on the team and it's our team, but I feel like our proactive support in all fronts is phenomenal. We just quickly jump in to resolve any issues as quickly as possible. But on the other end, when someone's never used transportation, they see the impact, but I think it takes a little bit longer because they have no baseline to compare it to. So then it comes to, wow, this is super beneficial. We're seeing our patients really utilize this, but that ramp period to get to that point it's a couple months, just so that they're starting from something new, adapting the process, and then championing the process. And then from there, we see the excitement and the benefits they see from it as well.
Awesome. Thank you so much. And then I wanted to call on Jim Beck, since this is something that you have a lot more expertise. I mean, do you have anything to add about the gaps that are existing in Alaska, specifically maybe in Mat-Su, that you're working on?
How much time do you have? No, joking. I actually wouldn't really tout my expertise too much on this really complex service, but I do know for instance, where I live and work in the Matsu here is not completely atypical, probably for a lot of other rural parts of Alaska where we have a real patchwork of transportation providers. In fact, our public transportation here in Matsu is provided by two nonprofit organizations, one senior center and a tribal provider is sort of our patchwork of public transportation. And they cover an area of 25,000 square miles, about the size of West Virginia. So it's a relatively impossible task. And we've, like other areas, we have a smattering of organizations that have their own vans. They tend to haul their own clients. A lot of them see those rides as part of their therapeutic process, where they're doing things and talking to their clients while they're taking them to an appointment. What we're trying to do with our central dispatch, it sounds similar to what Ride Health is already doing. We're using the platform called TripSpark, which was already in use by one of our larger providers, but we're really trying to create a big tent that will scoop in as many of the human service providers who have vehicles available as we can. The three major providers out here, tribal and the two nonprofits, plus the fourth, which is a senior center, which actually does more rides annually than any of the other providers out here, but they don't serve the general population. But we're trying to with Central Dispatch, just create a way for the rider profile to match the ride, obviously. And so when somebody schedules for them, or they use the app, or they call in, they're matched with the cheapest ride that's closest to them that meets their profile. We're hoping to go live with the pilot in the next few months, real limited basis, just to see how it works. To my knowledge, right now, with just back to one of the questions, Medicaid with the state, we don't have a big contract with any transportation provider. It's still kind of wide open and the Wild West as far as billing Medicaid to transportation, as if I'm still correct on that. Yeah, I think the other thing that we struggle with here in Matsu is a real lack of local government funding involvement with transportation. So there's a real struggle for the providers to earn their local match, to pull down state and federal DOT dollars. The Health Foundation where I work has stepped in with local match for a couple of those providers for a few years while we're just trying to build the system out. We have all kinds of other funky stuff, like the state won't allow a fixed route system in the Matsu. So we used to have a deviated fixed route that was pretty useful, but right now we really only have a demand response system, so people can't get a ride in 20 minutes. They can get a ride tomorrow. They can try to get a ride in 20 minutes, and they might, depending on the capacity of some of the providers. But I do think that a central dispatch for us in Matsu will help to cure that, as long as we can create that big tent that brings other transportation providers in. What we're trying to do is get the right ride provider involved with the right ride, because we really value our nonprofit public transportation providers and we need them to be strong. They do rides that a lot of other organizations won't do, like Sunshine Transit here is based in Talkeetna and Willow. They do bring your pet to the vet rides from Talkeetna into Wasilla, which is, it's like a 60-mile run, something like that. I can't remember. We have a lot of people in dry cabins, so they do everybody go take a shower and bring your water jug rides. So really interesting kind of niche rides that are really important to the way that people function where we live. So again, we're hoping that we can reduce their costs by bringing in more appropriate providers through this central dispatch system, because we don't want our nonprofit, federal DOT funded organizations doing these rides that they can't afford to do, but we're hoping that we can find the right providers to do those right sized rides. So we'll know a lot more in a year. I would say we'll know a bunch, I hope, in 6 months. But it sounded somewhat similar to Ride Health, and I know from studying this a little bit, it's just incredible what a system like a Ride Health can do. And so as the Health Foundation here, we're part owners of the Matsu Regional Medical Center. So we definitely have a vested interest in how those patients flow in and out of the hospital as well. So yeah, that's probably more than you wanted, Jacqueline. That's kind of the large backdrop of where we're working here in the Matsu.
That's awesome. Actually, that was wonderful. And I guess I would imagine that a follow-up conversation between you and Amin might be very helpful, just cross-pollinating. I would love to know if there's other communities that Ride Health could possibly work with. It looks like you're on your way to this pilot project, and maybe Ride Health could help you with some of their coordination since they've got some of that figured out, but maybe you could also help us better understand, and maybe others here, maybe Bunty can help us figure out if this is something that's needed in Juneau or in Bethel. That would, I mean, part of what we're doing here today for Health Tie is we're trying to solve these things together. So I'll just stop there, and we'll run a little late today. We normally stop at 1:30 Alaska time, but I'm going to run a little bit late. Bunty, I called on you. Is this something that you think is needed in Juneau?
I hesitate to come up with too much of an opinion on this, but we do have, used to be Caravan, and I don't remember what the name is now, and hope maybe Jake can bring it up. And it works with individuals with disabilities and with senior citizens. And then, of course, there are Medicaid vouchers. I think there could be a use for this. It's always funny for those of us who are off the road system to sort of think about what's needed for getting places. And one of the limitations of the existing services is that they only go where the bus goes.
Mm-hmm.
And so if you're out the road past 13 Mile, or if you're out Thane, or if you're on North Douglas, they don't pick you up. And so something that would actually go on the entire road system that we do have would be welcome, and a way to dispatch that effectively would be very welcome.
Awesome. Well, I'll follow up. I think, Amin is in New York, New Jersey. And so I think he might be laughing a little bit about our road system and kind of the challenges. The dry cabin is quite a unique problem. Amin, did you want to maybe tell us a little bit more about services and help me wrap up this presentation?
Yeah, this was very helpful, kind of learning the landscape of Alaska. As Jacqueline mentioned, I do currently live in New York, and New York has its own challenges. I'm not saying it's much better than Alaska by any means. We have small roads with too many cars on them, and we are across 41 states. So we've faced a lot of the challenges of building networks where transportation deserts exist, or there's extremely rural, or working with indigenous populations. And I can see the challenges you guys face, and it's really awakening for me to hear more about this, because it's just not been something on our radar to date. I'm happy to explore further with any of you guys, just even on a contextual basis of learning more about Alaska, or you guys just learning more about transportation. I'm always excited to learn and be more educated about our country and different regions and how transportation plays in, and would love to share my knowledge across what we've done to date to hopefully benefit you all as well.
I just want to say a big thank you for coming today. And this has been a really rich conversation. So I really enjoyed the small, intimate group. I just will make sure that other people know about the service, Ride Health service, and be able to just continue this conversation. But thank you very much for your time today, Amin. And thank you everyone for coming today. I wish you all well. We'll see you here again in 2 weeks, and have a wonderful day. So thank you everyone, and I'll be in touch with some communication emails. Okay, goodbye everyone.
Thank you, Jacqueline.
Thank you.
Thank you. Nice seeing you, Jim.
Okay, goodbye now.